Basically, the thyroid is a butterfly-shaped organ that sits at the base of your neck, basically at the bottom of your neck. It sits above your trachea, which is your breathing tube, and right below your larynx, which is correlates to the Adam's apple in men and the same type of area in women. In most people, you actually can't feel your thyroid. In some people, it's actually normal to have a little bit of a bump in your thyroid, but in many people, there can be a bigger enlargement in your thyroid, and I'll talk a little bit about that tonight. So your thyroid, again, it sits right here at the base of your neck. It makes thyroid hormone, and that's labeled here as T3 or T4. Those are the two types of thyroid hormone that you generally make. The thyroid is under control by an organ that sits at the bottom of your brain called the pituitary. The pituitary makes TSH, also known as thyroid stimulating hormone. It goes to the thyroid and it tells the thyroid, okay, we need to make more thyroid hormones, so then the thyroid makes it, or we need to make less thyroid hormone so the thyroid backs off. So the thyroid controls a lot of things in the body. It controls bone and bone development, heart function, energy usage, brain development in the fetus, brain function in adults. It regulates body temperature. It helps your muscle to function. It has a small role in calcium balance. It affects almost every organ in your body and almost every system in your body. You name it, and it probably touches a little bit of it. But that's not the whole picture. It plays a role in everything, but it doesn't completely regulate anything. So it is an organ that if you have an abnormality in, it's very difficult to necessarily pinpoint if it is really the thyroid or not. So some of the diseases that I'd like to talk about today are thyroid goiter, which is an enlargement of the thyroid, hypothyroidism or low thyroid hormone function, hyperthyroidism or high thyroid hormone function, thyroid nodules, and thyroid cancer. So thyroid goiter, like I said, is an enlargement of the thyroid. It can be caused by many different things. One is iodine deficiency, which is actually really rare in the United States. Our food is actually supplemented with iodine, such as in salt, and also in a lot of the flour, breads, and things like that that we have. So most people who eat a normal Western diet, or even just a normal diet that uses normal salt, does not have iodine deficiency in the U.S. There are autoimmune diseases where your body actually attacks itself, such as Hashimoto's disease or Graves' disease, that can cause an enlargement of your thyroid. There's also such things as multinodular goiter, which basically means you have a lot of goiter or a lot of nodules in your thyroid, and those nodules grow and become large and become a goiter. And less common diseases such as infiltration, where you have an infection or a cancer that actually goes into the thyroid and makes the thyroid large itself. And sometimes an inflammation of your thyroid can cause your thyroid to get enlarged. Most thyroid goiters are benign, and we just need to follow it, but you should get it followed up by an endocrinologist just to make sure that it's nothing dangerous. Now, as far as hypothyroidism goes, or low thyroid hormone, there's a lot of signs and symptoms that people can have. People can feel cold, be constipated, have dry skin and hair. You might be a little bit forgetful, might have depression. You may gain weight, and some people actually have muscle aches and cholesterol problems. And in women, you might have menstrual irregularities. In men, you might have decreased libido, things like that. Some causes of low thyroid hormone levels are autoimmune disease, such as Hashimoto's disease. Some people have reasons to get their thyroid out surgically, and if your thyroid is removed, you don't have a source of thyroid hormone anymore. Some medications can cause you to have thyroid or low thyroid hormone level. If your thyroid is inflamed for a long time, it might actually burn out and no longer be able to make thyroid hormone. Iodine deficiency can also cause low thyroid hormone level. Some kids are actually born with low thyroid hormone, and it's congenital. And there are other very rare diseases such as infiltration, basically from cancers or infections, and also pituitary disorders may also cause low thyroid hormone. When you go to your primary care doctor or an endocrinologist, we evaluate you first by history, personal and family history, and also physical. And the blood tests that we would get are your TSH and your free T4, which is probably what you got drawn this evening. And treatment for low thyroid hormone include levothyroxine, and these are some of the brand names such as Synthroid, Levoxyl, as well as others that you will be given for your low thyroid. For hyperthyroidism, which is having too much thyroid hormone, some signs and symptoms that you might expect to have are you feel hot, you have racing heart or palpitations, tremors, anxiousness. You may have frequent bowel movements. You may lose weight without trying, but some people actually keep the same weight, or some people actually even gain weight. It's a little bit hard to tell, but most people lose weight. You may have some hair loss. You may, by the end of the day, feel really, really worn out, and you might have trouble sleeping, skin problems, and menstrual irregularities again. I don't know if I mentioned this with the low thyroid, but some people have all of the symptoms that are listed here. Some people only have one or two, and other people don't notice a thing, and they are just caught because they have some other problem that their doctors find, and then they get their thyroid hormones checked, and they find that they either have too little or too much thyroid hormone. So it's difficult to say exactly if you have it or not, unless your labs are actually checked. So some causes of high thyroid hormone are Graves' disease. That's an autoimmune disease. You can have inflammation of the thyroid from just having infection. Some medications can cause it, and also other autoimmune causes. And some thyroid nodules actually can make thyroid hormone just on its own. And evaluation here again is history and physical. Also, you get blood tests with the TSH and the free T4. And we might do some imaging of your thyroid depending on exactly what we find from the history and physical. And treatment for high thyroid hormone level includes medications such as methimazole and propylthiouracil. We can also give you a radioactive iodine pill to ablate it. Basically, it kind of burns off the thyroid, and as a last resort, sometimes we do surgery also. As far as thyroid nodules goes, a lot of people get thyroid nodules, but most people, most of the nodules are benign. It's just a growth in your thyroid that you know, we need to monitor. It's kind of like having a skin tag. It just happens to be a growth that you have that not everyone has, but it's not malignant. You're not going to have cancer from it. Most don't produce any hormones, and though some can cause high thyroid hormone levels. The nodules can be single, which is by itself, or there can be one or two or multiple thyroid nodules. These nodules can stay the same size, they can grow or get smaller. Most of them tend to stay the same size or get a tiny bit larger, but nothing that most of the time would really concern you or you need treatment for. All the nodules, though, should be evaluated by an endocrinologist just to make sure that you get the appropriate biopsy if needed, you get the appropriate imaging that is needed also. When should you be worried about thyroid nodules? Basically anything that grows very rapidly. If you have any difficulty swallowing or breathing or any changes in your voice or hoarseness, if you have a family history of thyroid cancer, you definitely need to be a little bit more cautious. And if you have a personal history of head and neck radiation, not just regular x-rays, but if you had treatment for some kind of cancers as a child or for acne when you were in your teens or sometime in your life. Evaluation for the thyroid nodules include history and physical, thyroid ultrasound, biopsy if it's indicated, and then some thyroid scans, which is just further imaging if it's needed. As far as thyroid cancers, there's 4 types of thyroid cancers. There's papillary thyroid cancer, which is the most common, but it's very unaggressive. Most people have these thyroid cancers and they live up until their 80s, 90s without any problems with it, as long as it's treated and followed appropriately. There's also follicular cancer. It's more likely to spread, but also these cancers are fairly benign cancers. Anaplastic thyroid cancer is more aggressive, but these are very, very rare. And then there's medullary thyroid cancer, which depending on the type of medullary thyroid cancer or the, I guess the family history and everything is maybe more aggressive or not. But it tends to run in families. So like I said before, most people with thyroid cancer die with the thyroid cancer rather than from thyroid cancer itself. Thyroid cancer tends to be very benign cancers. You do need to get them evaluated and treated appropriately, and you definitely need to follow up with an endocrinologist for those thyroid cancers. And that concludes my talk. If anyone has any questions, I'm open for questions. So some of the medications that can affect your thyroid are medications for your heart. It's called amiodarone. It actually has a lot of iodine in it, and like I said, iodine can affect your thyroid a lot. Other medications are actually medications used either to treat rheumatological issues or cancers. They're a little bit rare, and it's more in specific patients. Other medications such as lithium can also affect your thyroid. So those are kind of the main three medications that I think about. There are some medications here and there that have, you know, rare case reports that, you know, I probably would even have to look up on occasion. The pig thyroid, a lot of people will know it as armor thyroid. It is made basically from getting pig thyroid and drying it out and basically grinding it up and making it into a pill form. That's a simplified way of saying it, but there's not a lot of regulation as far as how exactly to make those pills. It's an older medication, and it tends to be a fairly safe medication to take, but we don't have a way to monitor it very closely because it's not as regulated as the synthetic medication, number one. Number two is, just like every person is different, every pig is different, and so every single medication that you take is going to be a little different. So we're always chasing our tail whenever we have a person on armor thyroid. Some people feel a lot better on it, but it can cause people to have more problems as far as their heart, a lot more palpitations and arrhythmias. It can if you have either too much iodine in your diet or too little iodine in your diet. Too much can make you have high thyroid hormone level, and too little can make you have low thyroid hormone level, and like I said before, it can also give you goiters. So that can definitely affect it. In general, in the United States, we are an iodine sufficient country unless you really stay away from all foods without iodine. Basically, when, as an endocrinologist, what I usually check is I check both the TSH and the free T4. And first off is that every lab has a different range of normal. So one lab might say that the upper limit is 3.5 and other labs will have it maybe 4.5. So it's lab dependent, so you should go with your lab. The next thing is that there are diseases that are subclinical, meaning that your thyroid hormone itself may not be abnormal, but the TSH is a little bit abnormal. And that is basically just your pituitary saying, okay, I know you're making enough thyroid hormone, but I guess it's working a little bit extra hard to make that thyroid hormone. So the TSH is pushing the thyroid a little bit. And there are certain times when we would treat subclinical disease, and it depends on if it's low or high. For low thyroid, definitely if you have symptoms of it. And then we look at things like your cholesterol, if you have other medical problems like heart disease, things like that, to see if we actually need to treat it or not. So I think in your specific case, you probably need someone to take a look at your disease and also any other underlying medical problems you have. Like I said before, every lab has a different range of the TSH. So the TSH is the main hormone that we look at first, and then we look at the free T4. So every lab has a different range. And for me, as long as you're within that range, then I think that you're okay. There's not really a magic number for anybody because every single day your body is reacting to different things, you are encountering different things. So your hormone levels actually are always fluctuating. So if I draw your hormone level now versus an hour from now, it's gonna be a little bit different from each other. It's never gonna be exactly the same. But as long as you're within that normal range and you're feeling okay, you don't have any other underlying medical problems, then that's what I look for. We think that there's a higher rate of thyroid cancers detected because actually we're doing more imaging in general. So a lot of people will come in for chest pain, let's say, and they get a CT scan, and the CT scan of the chest doesn't stop right here. It goes actually up here, so it might catch a little thyroid nodule here and there. And then people get further evaluation for that nodule and they find more cancers. So the statistic is that people are finding more cancers, but there are not more deaths from thyroid cancer. So we're finding it more because we're just able to detect it more. And like I said, most people die with thyroid cancer. So let's say if we had not had any of these imaging modalities, all of those people who would not have died of thyroid cancer before all of the imaging modalities probably would not die now, and they probably wouldn't have it detected, but you know, except for maybe at autopsy. As far as Hashimoto's goes, it's an autoimmune disease, and it can cause you to actually have both high thyroid and low thyroid. What happens is that sometimes your body makes antibodies to itself, and in Hashimoto's, your body makes antibodies to the thyroid. It goes to the thyroid and actually causes the thyroid to become inflamed. And initially, within the first few months or so, you may feel like you have high thyroid hormone level. That's because when the thyroid gets inflamed, the tissue is damaged and it releases a lot of thyroid hormone. After that phase of it, then what will happen is that a lot of people recover without any incidents. And some people actually will start to actually go into low thyroid hormone level because basically the thyroid gets burnt out and the tissue is destroyed. And so that's in general what Hashimoto's is. Sometimes it causes people to have a goiter and an enlargement in their thyroid, and other times it doesn't. A lot of times people don't feel the high thyroid hormone levels at all, that phase of it, and they just, you know, come into their primary care doctor and then all of a sudden they have low thyroid hormone, and that can often happen. Actually, that's one of the #1 causes of low thyroid hormone level, actually. So once you have Hashimoto's, if you recover from the high thyroid hormone level but you don't go low, you can have that again. Most people though tend to have basically just a slow fade out of their thyroid, and they tend to slowly have lower thyroid hormone levels, and then that is permanent. You don't tend to have it doesn't tend to come and go as far as your thyroid goes. So I would tell them to take it first thing in the morning with just water, wait 30 minutes before eating or drinking anything or taking any other medications. That's because thyroid hormone, it's very difficult for it to absorb into the body, and we want it to be as reliable as possible when it gets absorbed, so that's the best way to take it. So insulin shouldn't have any interaction with it. What does change thyroid hormone doses a lot is if your weight fluctuates a lot, that could be one thing, and just kind of different stresses in your life, or if you are not taking the thyroid medication the same way every single day or the same time every single day, then the absorption can be a lot different also. And those are the main things that I found. For me, some people have a little bit better absorption with the brand name medication for one reason or the other. Other people don't have any problems with it at all. The important thing is that you keep with the same brand, whatever you're using, brand name or generic medication, and the same manufacturer, because Synthroid because thyroid medication, it's so hard to absorb, and it can be variable. So we just want you to have the same type of formulation every single time so we can predict how your body's gonna respond to it. As far as different thyroid hormone lab measurements goes, the TSH, the T3, and the T4, those are the 3 main hormones that actually you produce and actually is active in your body. So there's really not another lab that I would recommend that you get. If you have a question regarding maybe the interpretation of your lab or your symptoms, then what I would recommend is that you go to a specialist to make sure that it's interpreted correctly. It can affect your blood pressure. In general, it doesn't have a huge effect on it unless you're very, very low. And counter to what you actually think, it tends to make you have a little bit high blood pressure. Mostly the bottom number, the diastolic blood pressure, tends to be a little bit higher. Sometimes if your thyroid gets large enough and it starts to push against your esophagus, which is the swallowing tube, or your trachea, the breathing tube, then you can have problems swallowing or you can have problems breathing. But there's a lot of other structures in your neck. So just because you're having trouble swallowing doesn't necessarily mean it's your thyroid, but if you're concerned, you definitely should have someone check it out.